Hello and welcome to this episode of Community Connections, airing right here on OROMIA11. I am your host, Anna Orr, and today we are talking about the measles, mumps, and rubella vaccination. Today we have a representative of the Minnesota Department of Health talking to you about keeping those you love safe around you if you plan on traveling this year. We are talking about prevention, we are talking about symptoms, and we're talking about what you can do to keep those around you safest. This is going to be a wonderful episode you won't want to miss. Welcome to the program. I am so excited to have you on this episode of Community Connections. We have today's guest, Mumps Rubella. You are the family nurse practitioner here talking to us about measles, the current outbreak that we are facing here in the state of Minnesota. Can you talk to me just a bit about what measles are for people that are unfamiliar?
Well, thank you guys for having me. I always love coming here. Measles is a virus. Here in Minnesota, last year we have had an outbreak that was pretty big. This year we're doing fairly okay. However, New Mexico and Texas are not doing so well. They both have a huge outbreak. Way over 200 people have been diagnosed so far. Here in Minnesota, we're still doing well, but however, it's still early on in the year where people are traveling. It's spring break, they're going to other countries, they're traveling around the states, so measles could be easily picked up while you're traveling, specifically for those that are unvaccinated or under-vaccinated. Measles is one of those viruses that is airborne, so it's one of those where you, if you sneeze or someone that has it sneezes in a room or coughs in a room, it kind of sticks around for like 2 hours. So if you were in an elevator and someone sneezed in there hours ago, you can still get it. So it's one of those viruses that the only way to be protected is through the mumps, measles, and MMR vaccine, mumps, measles, and rubella vaccine.
Now, you told us about people sneezing, and you think about how often you're around someone that's sneezing, whether you're in a classroom, an elevator, a cubicle. There's always on a plane, there's always someone sneezing.
Yes.
And I know when COVID was around, we were always so worried about someone coughing a lot. And now we need to worry about somebody sneezing and passing around measles.
Absolutely.
As people are traveling, what are some things that parents can do to start to prevent their children from getting measles and themselves?
Absolutely. So the number one thing here in Minnesota is we have MIC, which is where we put everybody's vaccines in. So let's say you want to go and travel, you want to go to Africa, you want to go to Europe, you want to go to Asia, whatever it may be, go on ahead and go see your primary care provider, your children's pediatrician, and say, hey, you know what, I want to see so-and-so's vaccine records. They just pull that up for you. You can look at if they're up to date on their measles vaccine, so their MMR vaccine, or any other vaccines. Also, within the same time, most providers track what's happening around the world, so they'll tell you what is needed for their vaccines, like what else is an outbreak in the country that you're going to, so that you're protected while you're there.
Now, for people that are interested in getting the vaccine, well, first off, let me backtrack just a little bit. We were talking earlier about COVID, I mentioned, and we knew COVID to be a pandemic. Measles is an endemic. Can you talk about what an endemic is for people that may be unfamiliar?
So measles is one of those things that we have developed a vaccine for like many, many years ago. With being vaccinated, we can keep it down in most places. When not everybody has access to vaccines around the world. So there may be countries where they're not vaccinated or they're under-vaccinated, and it's really just happening over there. But over here, for many, many years, we were able to pretty much just get rid of it through vaccinations. So by vaccinating our kids at 12 months, and again, between 4 and 5 years, we could keep the numbers down. However, there's areas in the world where, because that's not happening and that's not the priority, it's just rabid over there. So if you're ramping over there. So if you're traveling over there, you're picking it up. So it's not consistent around the world, but it is, in areas of the world, it's a thing that people just live with, again, because that's not a vaccine, it's not a priority, or access to vaccines is not available.
Okay. Mm-hmm. Now, if they are getting the MMR vaccine, is this a one-time vaccine, or is this something that they'll need to continuously get?
Okay. So the young and adults, this is a 2-dose vaccine. So when a child is 12 months, we give the first dose. We wait for a couple of years. We used to wait until 5 years, but now you could get it 4 years. Matter of fact, if you're traveling, you could talk to your doctor, kid's doctor, and say, hey, I'm gonna be traveling here. Measles is, they have cases of measles. Can I get it ahead of time? And your doctor will make recommendations. However, a child gets at 12 months, again, second dose at 4 years. For adults, it's a little different. Let's say you're an adult who has never received the MMR vaccine. We have adults who have never received it before. Mm-hmm. You go into your primary care, they'll tell you, oh, well, you haven't had your first dose yet. We give you the first dose today. 28 days from today, you get your second dose. So within a month, you could be fully vaccinated.
Now, you spoke earlier about outbreaks taking place in Texas and another state you had mentioned mm-hmm. aren't doing so well in numbers. How is Minnesota faring currently with the cases and outbreaks?
This year, we actually have 0 cases. So we're pretty happy about that. Again, like I said, it's pretty early on. The very first, time for people to travel has been spring break, so we haven't really had our summer breaks. Are usually everyone goes everywhere. It's a pretty diverse state, so people will be going all over. So we're hoping to get ahead of that, tell parents to go and visit their primary care providers, go to we have really great travel clinics here in Minnesota that follow trends of diseases, what's happening around the world, get ahead of it, and let's get vaccinations. If you're feeling one way or another about the vaccines, get information from your doctors, especially in your own languages.
I think that's very important. Mm-hmm. So many people were nervous about vaccination throughout COVID. I'm grateful that you're here today so that we can continue to reduce stigma mm-hmm. around this. Many people during the time of COVID were going to CVS and Walgreens getting their vaccines. Are you able to get the MMR vaccination at a Walgreens or something like that, or do you need to see a primary?
You could get the vaccines really anywhere. However, I always tell people, especially those that have kids, follow a pediatrician. Your pediatrician will keep you on track for your vaccines. So you're not getting it here, you're not getting it here. You get it with one person or one clinic in that sense, so that you know what you're missing and what you're not missing. So there's a lot of vaccines that are given through childhood. So you're given the CDC chart. So mm-hmm. your child gets this at 2 months, your child gets this at 4 months, at 6 months you get this, a year you get this, 4 years you get this, all the way to the meningococcal and those vaccines that you get later on. So that's what I would say. However, if there is you don't have access to a clinic, get it wherever you can.
Okay. Now, you talked about we currently are sitting at 0 cases in the state of Minnesota, which is wonderful news. But can you talk to me about the fatality rate from measles?
Yep. So measles is a really painful condition. It's a condition where it starts with no symptoms for a long time, about 10 days. After 10 days, where you start with these bumps in the face, in the chest, and all the way down to the legs. It has fever, and there's sores that develop inside the mouth called cup-like cup spots that happen inside the mouth, and which make eating difficult. Mm-hmm. Dehydration is a big thing that usually people who have the condition go through. Oftentimes really, really, really high fevers. Oftentimes people get hospitalized for that. Encephalitis, so fluids in the brain, and obviously death could happen.
That's really awful to hear about.
Yes, yes.
Now, does measles show up differently in children versus adults?
So mostly kids get it compared to adults, because number one, adults usually are vaccinated. Number two, adults are not in confined spaces like schools, after school activities, sports teams. They tend to stay really close to one another, all the sniffly, sneezy, and touching everywhere and touching their face, right? However, of course, because they're younger, their immune system is not as developed as adults. They do, when they get it, they are more sicker than adults. However, let's remember our immunocompromised and elderly people too. They can go through the same thing that the kids are going through.
Now, after people receive the vaccination, what should they be keeping an eye out for?
Getting fully vaccinated. So the first MMR dose is about like 93% effective. You want to get your second dose to be about that 97% effective. Nothing is 100%, right? When it comes to vaccines. However, 97% is better than 0%. So I would say watch out for where you're going. Other people that are traveling with you vaccinated. How long has it been since your last vaccine? Do you have both of them together? I mean, if someone is sick and you know they're not vaccinated, kind of putting that person in away from other people, not sending your kids to school when you think that they may have that, or after school activities or sports teams or anything like that.
I think that's very important that you said that. Not sending your children to school when they are not feeling well will help cut down the spread of many illnesses, not just measles.
That's true.
Now, you spoke earlier about disseminating the information regarding vaccine and measles, mumps, and rubella around 2 different languages. What is taking place at the Minnesota Department of Health to make sure that this information and the continued information on outbreaks and illness in the state of Minnesota is being linguistically sound?
So for many years, Minnesota is a great place. It was a really diverse place. For many, many years, as long as I can remember, there were always, most of the languages were represented when it comes to vaccine information. You can always look up MDH. They update it consistently, especially if they're adding new languages. CDC has really great ones on vaccine information. So there's a lot out there. We're really, part of being in Minnesota is that you could always get a provider that speaks the same language as you. So you can go and see and talk to them, especially if you can't read the language you speak. Because remember, a lot of people can speak other languages, but they're not able to read it, especially if they have never studied like formal education. Because a lot of the stuff is on conditions and symptoms and medications. And if you don't really understand those in your own language, you don't want to, it doesn't make any difference for you. You'd rather have a provider that speaks that language, explain those conditions to you in a very lay language, normal people words, I would say.
I think that's very important. There, like you said, we are so culturally diverse here, and we have to make sure that everyone is being reached in the language that they can understand so that they're able to take care of themselves and those around them. How is social media being used to disseminate some of this information? Because I know you spoke earlier about looking up information, but there are so many people who are so frightened and deal with being overwhelmed with the information that's consistently coming in on the news. How is social media being used to kind of help get this information out to the masses?
So social media has its ups and downs, of course. One thing that for sure, especially for immigrant communities, they follow social media, especially people that speak the same languages. Oftentimes, representation could be off when it comes to who's giving that information. Is that a provider that really understands what's happening, or is that just a person who has opinion on things, which we do know there has been many opinions given on vaccines where people thought was true, and we are currently still as providers working through that, saying, well, that was not the truth, that was someone's opinion, right? So I would say, yes, social media is being used. Not a lot of providers from the diverse communities are in it, in my opinion. However, there is great information there. Also, getting the reports on numbers, what's happening in one area, what to avoid if you traveled here, is a great thing to know. So then you could go to your local travel clinic and say, hey, I will be going here. I have noticed there's this condition. What could I do before I leave? Right? So I think social media, in medicine, it really is, yeah.
What has been the community's response thus far to you guys trying to make sure people are getting vaccinated against measles, mumps, and rubella?
I would actually wrote the other day, I have had several people come up to me and say, hey, I saw you on OROMIA TV and you give vaccines, right? Can you tell me about this? Again, they may be just showing up for COVID vaccine and want to know more about it, or it could be that they're coming in for childhood vaccines. So there's been a lot that I've heard from the community regarding this, the input of putting information out there, saying, hey, we're here, we can answer your questions, we're here for you. You don't have to bring your child to get information from me. If you had a question, you can say, hey, you know what, I want to make an appointment with you. I have a question on this. Can I come and sit down with you for a few minutes? Why not? Of course.
I think that's wonderful. Word of mouth is always sometimes the best way to get your questions answered, but to also figure out the best route for you and to spread information that is factual.
Absolutely. Especially when it comes to kids, right? All parents want their kids to be safe and thrive. And oftentimes, if they don't have enough information on something, they're not gonna just give it to them because they don't actually know what it's for, or they're not feeling very comfortable about it. So I say seek information, get answers.
I think that's a wonderful place to end this interview. Thank you so much for joining me today. It has been really important not only to talk to you, but also to hear about the work that is going on at the Minnesota Department of Health around MMR vaccinations. Unfortunately, that is all the time that we have for this episode of Community Connections. Please make sure that you talk to your primary care physician about the MMR vaccine. You are inquiring about illnesses as you travel, where you are headed to, and making sure that you are keeping your kids at home if they are not feeling well. As always, I am your host, Anna Orr. This has been Community Connections, airing right here on OROMIA11. I look forward to connecting again with you soon.